Welcome to the T-Scan training video. This instructional video will show you how to assemble the T-Scan handle, add a patient to the database, set the sensitivity, and scan and playback your patient's bite. Before we begin, let us take a moment to verify that your T-Scan system is complete. You should have the following parts: one scanning handle, one box of large and one box of small sensors, one box of large and small supports, and the T-Scan software disk. The support should provide enough width to clear the molars and allow the patient to close comfortably. Trial and error may be necessary to determine the correct support size. Attach the support to the T-Scan handle with the sensor position guide face up until it clicks into place. Next, lift the latch and insert a sensor, which must be the same size as the support, this side up, through the support so that the outside edges of the sensor slides into the support channels. Close the latch to lock the sensor in place. A green light will indicate that the sensor is properly connected. Launch the T-Scan software by double-clicking the T-Scan icon on your desktop. The software will open with the patient list. A patient record must be created for every new patient prior to taking their first scan. To create the patient's record, click New Patient. Fill in the patient's information: first, middle, and last name, gender, date of birth, and their ID number. The ID number is optional. Next, fill out the tooth chart to create an arch model that replicates your patient's upper dentition. Begin by measuring the central incisor width. Enter this number into the central incisor width field. Continue filling out the tooth chart by choosing a status from the drop-down menu next to the appropriate tooth number. For example, if the patient is missing their upper third molars, select the drop-down menu adjacent to teeth numbers 1 and 16 and choose Missing Open. If the patient has had a bilateral extraction of their first bicuspids and the spaces have been closed due to orthodontic intervention, choose Missing Closed. Continue until the arch table accurately describes your patient's upper dentition. Click Create, then click New Scan. Insert the sensor by rotating it into the mouth like that of an impression tray. Have the patient open their mouth slightly. Use the edge of the support to pull open the patient's cheek while pulling the opposite cheek open with your finger in order to elongate the mouth. Insert the sensor so that the position guide is touching the central incisors at the midline. Hold the sensor in place so that the sensor is level with the occlusal plane. T-Scan uses a range of colors to differentiate the forces on the teeth. Adjusting sensitivity ensures that the entire color spectrum is used to visualize the differences in these forces, and that the maximum forces are within the sensor's force range. Ask your patient to bite and clench firmly. As the patient is clenching, observe the tooth contacts on the screen. The ideal setting is to observe at least one, but no more than 3 pink contacts while your patient is firmly clenched. If you see more than 3 pink contacts, decrease the sensitivity by dragging the slide control to the left. Have the patient clench again. If there are no pink contacts, drag the slider to the right to increase the sensitivity. With the sensor in your patient's mouth, press and release the red record button. The sensor status indicator will change from sensor OK to a frame counter, and the green record light on the handle will illuminate. Have your patient bite, clench, and release. Click the red scan button again to stop recording. The recorded scan is now displayed on screen and is ready for review. To take another scan, click the white button on the handle to open a new real-time window. To save the patient scan, click the Scan Type drop-down menu. Choose the type of scan that was performed, then click the Save Scan button. To playback your patient's scan, click the Playback button. To stop the scan, click the Pause button. To play the scan one frame at a time, click the Next Frame or Previous Frame button. Alternatively, the following keyboard shortcuts can be used to play scans. The space bar will play and pause the scan. Clicking the right arrow key will play the scan forward one frame at a time. The left arrow key will play the scan backward one frame at a time.